Well, public health units in Peel and Toronto are cracking down on factories, warehouses, and other businesses that are allowed to remain open during the stay-at-home order. This means any business with 5 or more cases of COVID-19 will be forced to close, and the move comes despite the fact employees might not get paid if they're sent home.
The game has changed with the variants, and what we're seeing in our workplace outbreaks is more cases spreading more quickly.
Peel Region's medical officer of health was the first to launch this crackdown, and here's why. Over 3,600 cases have been recorded in the region's workplaces so far, with more than 400 outbreaks. And a survey found 1 in 4 essential workers are still going to work despite having symptoms.
The vast majority of COVID cases go from workplace outbreaks into community spread. In Peel Region, our largest employment sectors tend to be food processing and transportation logistics. So these lockdowns don't really affect their business. And so I'm glad that we're now looking at ways to control spread within these workplaces.
And a few hours later, Toronto Public Health announced it would be following suit. Do you think that these public health units are in a position where this is a measure that they had to take to fill in the gaps left behind by the province?
What we don't want is a patchwork framework of different municipalities and different regions taking a different approach to workplace safety, to paid sick leave, and other critical matters. But in the absence of province-wide action, at the City of Toronto, we will do what it takes to keep our residents safe.
So starting Friday, any workplace in Toronto or Peel with 5 or more cases identified within a 2-week period will be forced to close for at least 10 days. All employees must self-isolate and are not permitted to work elsewhere, and employers are strongly recommended to provide paid sick leave. Just because employers are being asked to pay their employees, it doesn't mean that they will. And some of them probably won't.
Well, we have seen an outcry from the medical community, from mayors across the country, and now we see public officers of health taking the matters into their own hands. So I think this is a real wake-up call that this has to happen, and this must happen now.
Dr. Lowe, the Peel medical officer of health, actually had the courage to do today what the Premier has not had the courage to do.
Once again, paid sick leave was a hot-button issue at Queen's Park. The Minister of Labour was on the defence, saying the province did its part by creating job protection, and the rest is on Ottawa.
In new spending, more than $100 billion yesterday, and not even a fraction to deal with the concerns that Ontario has been raising when it comes to protecting the health and well-being of workers.
Well, I'm tired of the finger pointing between both the federal government and the provincial government on paid sick days. They're both wrong. They are both wrong. This is about saving lives. This is about protecting employees.
Now, once again, these shutdowns would be starting on Friday. We're still waiting for a list of what businesses will be forced to close. When asked about it today at the legislature in Queen's Park, Health Minister Christine Elliott told reporters there's nothing unusual about medical officers of health taking added measures in their own regions. She likened it to what we saw with school closures in these regions just a couple of weeks ago.